Decision for the country in the face of rising COVID-19 numbers, a struggling economy, and, dare I say, a defiant political class. And of course, at this moment, we want to speak to the experts on what should be done to influence any new lockdown measures from our health and public behavior position, and also from an economic position as well. And joining me for this discussion is Professor Lukoya Twoli, Dean of Medical College at the Aga Khan University, and Joy Kiru, a senior economist at the University of Nairobi. To both of you, thank you for making time. And of course, to our viewers, remember, I'll be checking your messages on 22422 using the hashtag NEWSNIGHT. Now, Prof, we spoke about this, I would say, 3 or 4 months ago on this same program, COVID-19 fatigue. It's been here with us since March. We've been talking about social distancing, wash your hands, sanitize, avoid public gatherings, and fatigue has clearly set in. The daily Ministry of Health lectures, I mean, people don't pay attention anymore. You know, if you're out there as they're being streamed, we still carry them live here on Citizen TV, they're not following. For you, is it time for a change of strategy? And what would that strategy look like?
So, Wahira, thank you very much. I think it's true. We've talked about this since March. We've talked about this in June. We talked about this in July when things were getting really bad. But the unfortunate problem is that for a pandemic related to an infectious disease of this kind, the control measures are very simple. The whole goal is to ensure, firstly, that the virus doesn't get into your body, and it gets into your body through your mouth, through your nose, through your eyes. So preventing that is a primary thing. And from a population perspective, how do we prevent that? By keeping people apart as much as possible. And when people have to be close together, ensuring that their mouths are covered, their noses are covered, and so on. So creating a situation that doesn't increase the risk of transmission is a primary mode of prevention of infection. Unfortunately, at the moment, we have reached a place where there is widespread community transmission of this virus. We can argue that the strategy of trying to prevent infection of a large segment of the population, that time is past. Now, it is time for us to start thinking about how do we handle a pandemic that is well established in the population and that is spreading like wildfire in the population. The goal still remains the same. The goal is still to ensure that the health system is in a state in which it can handle any number of COVID-19 cases that emerge in the community that require intensive care or critical care. That is the goal of the intervention even now. So keeping the numbers down as much as possible, lengthening the transmission period so that as few people as possible are infected at any given time is the goal. Now, any political moves, any economic moves, any decisions that are made to control it must have that as a primary goal. Now, if you have unlimited resources, if you have unlimited numbers of health workers, unlimited hospitals, unlimited health resources, then you don't have to do anything. You just wait for people who get sick and you treat them in the hospitals and you continue their life as usual. Unfortunately, we are very far below any nation that can claim to have sufficient resources. And therefore, we have to take measures to keep the numbers of new infections down so that among those new infections, we keep the numbers of those requiring acute and critical care down.
Prof,
and that is the only advice the health workers have been giving since March. That is the only advice we will keep giving until this pandemic is over.
Prof, I don't know if you can hear me, but tell me this briefly. And I say this sensitive and aware to the fact that many Kenyans have lost loved ones tonight to COVID-19. Well, it's not a joke. But do the threats still work? Should the president tomorrow speak, and those who speak, should they speak and, continually warn Kenyans? Should that be the tone of communication? Or should we see a change? What do you say to what would be the most effective way to move the nation forward in the right manner?
The threats, Wahiga, the threats worked at the beginning. I can tell you that there are few people who listened to the threats, got scared, and decided to take actions to protect themselves. With widespread community transmission, threats are no longer useful. It is time for action. And government must take action based on its own economic abilities, based on its own security abilities, and based on the resources available to the government. Therefore, going and telling people that COVID-19 kills is no longer a useful strategy, because everybody knows that, yes, COVID-19 kills, but in fact, some people will get COVID and recover. So it's no longer a useful strategy. Right now, our goal should be to contain the infection so that we keep the numbers of those that are critically ill down, so that we can continue to manage them in our health facilities and prevent our health facilities from being overrun. Going out there and telling people, threatening people about COVID-19 is no longer a useful strategy. Right now, the strategy must be about what resources are we putting in place to deal with the inevitable surge, to deal with the inevitable rise in the numbers of people who are sick, and to reduce the inevitable mortalities that we are continuing to see.
Prof, let me interrupt you there because I want to bring in Joy Kiru. And Prof, you've already mentioned economic constraints that the government will have to deal with as they think about what new measures might be put in place. What considerations from an economic perspective should the government be thinking about tonight, Joy Kiru? What is important right now from an economic perspective, even as we weigh the health aspect of this pandemic?
Thank you very much, Wahigwa. As we think about this pandemic, the government must ensure that Kenyans do not suffer much more than they have suffered. And that does not mean that they must just let people do whatever they want to do. No, we would want to see them think about Kenyans' livelihoods in a manner that is well in tandem with the fact that really Kenyans are the only ones who take care of themselves. If you talk about what the government can do to Kenyans to help them protect them from the pandemic, for example, or be able to assist them during the pandemic, we talked about social protection before, and we saw how it went. Weak capacities in terms of distribution, and at the end of the day, the most needy Kenyans were not reached by social protection. So now we are wiser than we were before. We know that Serikali's idea may not be the best strategy for Kenyans to think about. So as we talk about the economics of how Kenyans survive, for example, we would like to see a situation whereby, yes, Kenyans are sensitized about personal responsibility even as they go about earning their own livelihoods. But COVID-19 is there, but again, there is behavioral aspects that can help all of us overcome. So in the minimum, I expect the government to consider that really at the end of the day, it's a personal household head or somebody in the household who must bring food to the table, and they must be given enough space. They must be given enough sensitization to be able to do exactly that. But again, personal responsibility in how we conduct ourselves is really what is going to matter here.
Joy, I've got a question for you, but first let me read some feedback here. Kipleting Manuela saying, locking down counties will not stop the spread of corona as we are battling local infection. We should strictly adhere to Ministry of Health guidelines and protocols. Individual responsibility and self-discipline is the key in fighting COVID-19. Dr. Andrew Sule is saying the focus must now switch to the care of the very sick. COVID-19 times for restriction, lockdowns, curfews, and blame games is now water under the bridge. Let's improve the capacities of county health systems beyond hospital beds. Counties also have a shortage of specialists, and I can see Prof. Lukoi nodding towards that, while Edwin Nyakweba says any closure in the Kenyan context will not yield much as COVID is concerned, not unless we do a total lockdown, which is not feasible in the Kenyan setup. People need to work to eat. And Joy, I want you to talk a bit about that. We know SMEs have shut down. We know small-scale business people who've had to either change their business model, change what they are offering, or just stop transacting altogether because it's impossible. Even as the government seeks to enforce COVID-19 measures, what more can be done to especially protect SMEs and small-scale businesses? In Europe, we saw what's happening. If workers are furloughed, they're given an allowance to tide them through these tough times. We're not quite seeing that here. What would your recommendations be?
This is something we've been talking about, that some of the cushioning that the government has done has mainly been in the formal sector. But now, of course, after we started discussing these issues, we have seen some measures about the credit guarantee schemes, and you have seen some activity towards the informal sectors whereby they are trying to procure from the local artisans. That's a good move. That's a good move. But of course, we want to see a system that is not just haphazard, which is not just like today you wake up, you want to go to Dandora, for example, find the youth doing something and you promise them something. We would like to see a structure, a good strategy to ensure that even the informal sector, there's something for them. If we talk about those who are suffering the burden of this pandemic, really it's the women and the youth and our fibroid private sector, which mainly it is actually informal. A big extent of the private sector is informal. Those are the guys who have suffered the biggest burden of the pandemic. We need to see specific strategies targeting the youth, women, and the informal private sector, and in a very structured manner. That is still not there as we speak.
Okay.
It's quite haphazard, it's quite random, and we'd like to see something change towards a proper strategy of reaching those who have suffered the most in the economy.
One could say that's your prescription for the economy and for the most vulnerable in that. Let me get Professor Lukoi's prescription for the health sector and what he expects to hear from the president. It's actually a story we did where we spoke to medical experts, Prof, about what they hope to hear tomorrow. And I know you've alluded to it a little bit, but please tell us now, in terms of specifics. I'll give you an example. Ian Bogwa on Twitter, he feels that political rallies, social gatherings, church services, weddings, funerals, etc. must all be stopped for now. Do you agree with that, Prof?
Well, so the thing is, the government has to make a decision. And the decision they have to make is, are they willing to take the risk of massively increased numbers of very sick people coming to our health system? And are they ready to handle those numbers? Or, if they are not ready to handle those numbers, what can they do to keep those numbers down? Where do people get infected most? People get infected most in public transport today because there are absolutely no, precautions being followed. People are getting infected in religious gatherings, in churches, in weddings, in funerals. And people are getting infected in the rallies that we have been seeing over the past few weeks. So if the president's assessment is that the numbers have reached an unsustainable place and that we are no longer able to handle them, or we are soon not going to be able to handle them, then he must make a decision to reduce the numbers of people who are getting infected on a daily basis by reducing all forms of public gatherings. But if the president makes the determination that we are able to handle this, we are equipping the facilities, we have hired enough people, it's a political call, then he can decide to do nothing. From where we sit, we feel the public health system is not well prepared to handle the number of infections that are going to come up in the environment where there are massive gatherings that are happening almost every day in this country. We are seeing rallies in Kitui, rallies in Kisii, rallies in Muranga. We are seeing weddings that are overflowing. We are seeing funerals where people who have died of COVID-19, funerals that have hundreds of people attending, and very little by way of precautions by some of the people attending those funerals. These are fueling the pandemic. And so if we make a political decision that we cannot handle the numbers as they continue to rise, we must go back and look at those events where people are getting infected and start restricting those events.
Prof, Sir Nixon Dugire from Kindaruma via 2242 is asking you a difficult question. And because you are someone who has studied the human mind, hopefully you'll have an answer for that. He's saying, Professor, in your opinion, why are responsible leaders, I don't know why he uses the word responsible, not adhering to COVID-19 protocols when holding public or political gatherings? What is it about their minds that, I guess, makes them feel that they'll be safe or safer than the rest of us as we deal with the pandemic?
Yeah. So I will put it this way, and I like what you said. The assumption that all politicians are responsible human beings is a stupid assumption. If you take the mass of human beings, we have a good proportion of irresponsible human beings who end up in positions of responsibility, and our politicians are no exception. Secondly, we have the politicians who hold these rallies, who take all precautions to protect themselves. So they will be away from the crowds. They will be away from any risk of infection. They get tested regularly. The people around them get tested regularly. But then the crowds that come to see them do not have the same luxury. And so the politicians, some of them are very right in their assessment that they have very little risk of getting infected because they're keeping away from the crowds. But the crowds themselves, who are all over the place, are the ones who are at the greatest risk of infection. So it is true, when a politician stands there and feels safer than the crowd of his followers, the politician is actually right. But the people in the crowd who are coming to watch these politicians are at extremely increased risk. We are seeing people getting infected in their own homes in small gatherings, where one person comes in who is infected and everybody else in that household gets infected. We are seeing families being wiped out by this infection. So at the end of the day, people have to make a judgment call and decide, does this politician have the best interest of the people that are coming for these rallies at heart? And to a large extent, just like every other human being, they do not have your best interests at heart. They have their own best interests at heart. And you attending those rallies is feeding their ego and is feeding their best interest.
Okay.
So it's a decision you have to make at the end of the day.
Thank you, Prof, for that. And I think you've not minced your words around it. Let me also allow Joy Kiru to respond to a tweet from a Michael Ayeko, who says you are his lecturer. He's passed his greetings to you, Joy. But he's also saying this: help him understand what's more economical, further restrictions or continue with our freedom, quote unquote, at the expense of health costs and, of course, of human life as well. So he wants to know from an economy perspective, what makes more sense?
Thank you very much, Michael, and thanks for the greetings. I accept them. Now, economic freedom, or the freedom to carry on with the economic life, because really life must happen. You must eat. You must attend to a lot of issues that need that you must pay your bills. But again, the good news is that your economic freedom does not necessarily have to come with increasing your risks to COVID-19. We know the ABCs. Wash hands, wear your mask in public. Everybody if I wear my mask, wear your mask, keep that social distance, and we keep doing our economic lives, just moving on with our economic lives. Really, we don't have to be infected. So the good news is really, if you look at it really, we are wiser than we started before. Any more restrictions, for example, in the economy, might actually get us into a very bad situation. Remember, when people are broke, a lot of issues come up. There's insecurity issues, there's social unrest, because at the end of the day, everybody, it's about self-care. It's about taking self-preservation, trying to preserve your own livelihood first, at whatever cost before you starve to death. So again, too much restrictions may tip us off balance, and we might actually go badly. So the issue is, let us continue with our economic lives, while at the same time practicing the ABC of safety from coronavirus. Okay, Joy. That's really what I would recommend.
Indeed, Joy. And as your final word, I think a bit earlier on in the day you spoke to Raquel Moigai and you told her, as the president gives his outline some measures tomorrow, the economy part of it will be difficult to focus on fully because of the health aspect of it. And this is human life. Just briefly recap that for us as you give us your final word.
We must understand that what we have is a very tricky situation. And no matter what the president does, it's not going to please even a third of this country. There is a political economy of it, there's a health aspect of it, and there's economics of it. The political class, the lawmakers, the biggest lawbreakers as well, they have decided to go the impunity way, and they have disabled every other mechanism to enforce discipline in the face of the pandemic. That's a very big worry. Again, the president is also part of that political class. So there is a conflict of interest. If he wants to put on tough measures about the political class, this came to me an interest because there's a conflict of interest for him. The health practitioners have spoken loud and clear. They have said, stop these rallies, bring restrictions, and do that. But the economists also, our economics life, we need to eat, we need to pay bills. The government has proved that they cannot put measures and take care of us as citizens like they do in developed countries. So at the end of the day, this is going to be tough. But what you want to see, what you'd like to see is that nobody should be made to bear an unfair burden of the pandemic. He must consider that nobody is victim, is like punished in courts. Because, for example, just like I asked during the day, what's the point of imposing restrictions, more curfews, restrictions in movement, if the Laris and the political class is behaving with impunity? And will it even matter, will it even make a difference in terms of the infections if we stop some people from doing what they need to do to pay their bills? Really, those are very difficult questions, but the president must answer tomorrow and make a decision, and he's not going to please even a third of this country, no matter what he does. So he just has to come out and do what he must do the best he can.
It sounds like he's damned if he does and he's damned if he doesn't. Prof, how will you wrap this up for us? The organization that I know you belong to, Kenya Medical Association, are recommending tough, strict restrictions, including shutting down counties that are experiencing a spike in infections. As you give us your final word, is that something you would lend your vote towards?
Wahiga, I think the time, in my view, for locking borders and stuff like that is past. This is a time when we have to demonstrate our mettle as policymakers, as people who organize health systems and so on. And I will say this, economies and health systems that were designed to serve the people and that put the people's lives ahead of every other consideration have suffered less of a problem with COVID-19 than economies that put other considerations first. COVID-19 has exposed political systems that were led by selfish interests, that were led by considerations other than the lives of the people that are led. And it is time now to change that. If government determines that we want to put the lives of our people first, that we want to put the health of our people first, the measures that will be announced tomorrow will include increasing resources directed to the health system, increasing the capacity of the health system to handle this pandemic, increasing the testing capacity, and increasing public health interventions that reduce the risk of infection. Anything else at this time is too late. The infection is well established in the community, and there is absolutely nothing short of locking people in their own houses for a month that can interrupt this pandemic at this time.
Prof, I said a final question. This is my final one, and I asked Dr. Githinji this a couple of months back. You're invited for a social gathering. You know there'll be 300, 400, 500 people. Are you saying no?
Don't go. Simple.
That's what you're doing. Don't go.
That's what I'm doing, and that's what I'm advising everybody that is around me. I will tell you this, Wahiga. My wife works for a government institution. They organized a workshop today and for the next couple of days in Naivasha, where there would be dozens of people attending from all over the country. We said, no, she's not attending. The risk of infection is extremely high. I will not go into gatherings with strangers from all over the country, no matter what the payout is.
Prof, my goodness. That's how we're going to leave it. I have so many more questions, but our time is up, Prof, so I will spare you the interrogation. And of course, thank you so much, Prof. Lukoi Atwoli, Dean of Medical College, Aga Khan University, Joy Kiru, Senior Economist, University of Nairobi. Let's take a look at some of your feedback tonight on the program. This is what Kenyans are saying. We start with Sir Arens, who says, at this level, we don't need a lockdown, but emphasizing on people to heed all measures that help prevent the pandemic, since our government cannot provide finances for all citizens during lockdown. Okay, that's one. Thank you so much. Gure Gati says, lockdown or tightening curfew hours won't yield much. Law enforcers must enforce the already gazetted regulations fairly. Arrest, fine, and take Kenyans to court. It will work. It's that simple. All right, let's take a look at another one. Remember, the hashtag is NEWSNIGHT. Ole Carrington says, restriction of movement in and out of the cities helped cushion rural areas, making many residents ignore health measures that include social distancing and wearing of face masks. The laxity made rural areas more